Hello everybody and welcome to another episode of Uncovering India. Today's our topic of discussion is COVID and mental health. We know that COVID and the lockdown that came with it created a huge impact on the psyche of people not only in the country but also across the world. But while we know that it has had a huge dent on the psychology of the people, we don't know the extent of the problem it has created, and to know that the Goa-based internationally known mental health intervention center Sangath has come out with an online survey that tries to ascertain the mental state of people affected by COVID by taking their responses online. And to speak more about that survey, we have with us Dr. Abhijit Nadkarni, who is the head of Sangath's Addiction Research Group. Welcome, sir, to this occasion. Sir, we all know it has been widely reported mental health and the impact that it has been created by COVID, especially the prolonged lockdown. So, what has been your experience as far as your initial reports that you have been getting from your own studies, from the other international and national studies? What is the kind of impact we are seeing till date?
Yeah, so we keep talking about this slogan which goes "No health without mental health," and sometimes we pay it lip service. We just kind of say the slogan, but not kind of go to the heart of what it means. And then similarly, when it comes to COVID, I mean, although it's a physical health issue, and understandably everyone is focusing on the physical health impacts of COVID-19. What we have to understand that is in the short term as well as in the longer term, there are going to be mental health impacts, not directly related to the virus, but the things that happen around the pandemic. So for example, the lockdown, for example, the thing that some people might have to isolate themselves within institutions, within homes because of the pandemic, etc., is going to have an effect on people's lives, because this is not something that we ever expected to happen. So we are not used to a situation like this. So these are unprecedented times, and obviously they are going to have an effect on people's mental health. Now the thing is, because this is not something that we have been exposed to ever before, although we have a sense of the fact that it will affect people's mental health, we don't really know how it's going to affect people's mental health. We don't really know whether there will be some subgroup of people who will be affected more than others. We don't know whether certain circumstances are going to affect people more than other circumstances, etc. And so the whole idea behind doing this survey that we are doing is to understand this finer nuances of how the mental health of people could potentially be affected. And this came out because we were anecdotally or in our conversations with other colleagues or with what we were reading in the newspapers, were giving us an indication that this was, especially when the lockdown first started, was affecting people's psychological well-being. We were seeing a lot of media reports on suicides happening across the country. We were seeing issues related to alcohol use because that was banned in the first version of the lockdown, access to alcohol. So that was impacting people's lives. We were seeing a lot of reports in the media around domestic violence because of the lockdown, and people being locked up within small houses, being cooped up there, and what we call as cabin fever, I mean, kind of being locked up with a small group of people for long periods of time, leading to frustrations, etc. So we're seeing a lot of reports around that, but then at the end of the day, we can't rely on media reports to be scientific evidence. I mean, it gives us a sense of what's happening in society, but then we have to understand it in a more detailed manner.
We need to go more in depth.
Yeah, we need to go more in detail about what's happening, why it's happening, how it is happening, because at the end of the day, if we have to put action or we have to put things into place to resolve these issues or to respond to these issues, they have to be informed by actual things happening on the ground, and that's the evidence that we are trying to seek through this survey.
So, it's been, I think, a month or so since you launched the survey. What has been the response to the survey till now? How do you see the people responding to the survey?
So we have got a good response from across the country. The initial kind of reading of the numbers in terms of who is responding, we are seeing a lot of responses obviously coming from Goa because we have our networks within Goa. We are seeing a lot of response coming from Delhi. We are seeing a reasonably high response coming from our neighboring state Karnataka. So it's varied. I mean, but these are kind of the front runners in terms of the kind of responses that we are getting. We kind of are mindful of the fact that the responses we'll get will depend on the kind of networks that we have across the country and how the survey is disseminated across various parts of the country.
Preliminary, what kind of feel you are getting? What kind of responses you are getting? What is that you are making out of what you are getting?
So we just about kind of done some preliminary analysis of the data that we're getting. What we are seeing is a large proportion of the people understandably are worried about the uncertainty that's coming because of the pandemic. A lot of people are worried about their near and dear ones and what can happen to them, especially people who are dependent on them, so the elderly or the children. People are understandably quite worried about the futures in terms of the income or the sustainability of the income and their jobs. These are some of the key factors that are coming out in terms of things that people are worried about. Interestingly, but also not surprisingly, the other thing that's coming out is how informed people feel about the whole pandemic and the virus. And a large proportion of people don't feel confident about their knowledge or information that they have related to the virus or the pandemic. And a lot of this is, again, this is preliminary numbers, but a lot of this is understandably translating into stress and diagnosable mental health conditions like depression and anxiety. A lot of it is in the mild end of the spectrum, but almost a quarter of the people that we have surveyed are reporting symptoms which are in the depression spectrum, in the anxiety spectrum, what we call as common mental disorders.
Is there something worrying? Is there some worrying underlying that you are seeing which was not coming out earlier, and that is something causing an alarm bell, ringing an alarm bell?
Well, the very fact that many number of people are reporting common mental disorders, as we call them, is worrying, because this is going to be the tip of the iceberg, right? The reason I'm saying it's a tip of the iceberg is that one of the limitations of a survey like this, which is online, means that a certain strata of society has access to it, right? People who have access to internet or have data to complete this on the net. So primarily kind of the middle class, educated population which is responding to this survey because of the nature of how we are accessing the data, that is online surveys. Now if it is this strata of society which is relatively insulated from some of the socioeconomic impacts of the pandemic, is experiencing this amount of psychological distress, then obviously the amount of psychological distress in people who are from a lower socioeconomic strata, who are directly impacted socioeconomically, like the migrant laborers that we have seen or heard a lot about in the media, or the farmers whose economy is obviously going to be directly impacted by the whole pandemic situation, who don't have the security of a regular income coming in unless they are able to either work on a daily basis or don't have the social security networks that many of us from the middle class might have. the proportion of people experiencing psychological distress are going to be a lot higher than what we are seeing in this particular survey. And it's not just the proportions, right? And in a country as big as India, with such a huge population, I mean 1.3 billion population, the absolute numbers, like when you convert those percentages and proportions into absolute number of people who will be experiencing this, is going to be huge. The issue is then not going to be on the number of people who are experiencing this. The bigger issue is going to be who is going to provide them care. At the moment, the focus, and rightly so, I'm not kind of saying it's wrong, but the focus is on what can we do about the virus, right? What do we do about the people who are physically affected by the virus? The point is, the number of people who are going to be psychologically affected is going to be a lot higher than the number of people who are going to be affected. When we didn't have the pandemic, when we didn't have the virus, out of 100 people in India, approximately around 10 to 15 of those, if we have 100 people with mental health problems, around 10 to 15 of those had access to some kind of mental health services. Now, in this kind of a situation, that's going to get worse.
So then, do you have any proposal to take this offline also? The survey can be done, some sort of an offline mechanism can be introduced?
That would be perfect. I mean, the thing is, at the moment we are looking for partners across the country who are embedded within the communities, who are working within communities, who have access to communities, who will be able to go out there and do this offline. We are in conversations with at least at this moment, at least one organization which works in Haryana and in Andhra Pradesh, who might be interested in kind of doing this offline and taking it out there in the communities to do this. And that would be an ideal thing for us. But if we are able to partner with organizations across India who are integrated and embedded within communities, who have the resources to go out there and do this, we are open to these kind of partnerships to make this happen, because that would be the kind of the true picture. If we are able to go out there and access people who don't have access to the internet, who don't have the literacy levels to be able to kind of do this survey in English. That's another thing that we are trying to do.
Vernacular language.
Yeah, we are kind of looking at vernacular languages. Even if it is online, other people might be able to access it, and we kind of get a better picture of what's happening.
So what kind of intervention strategy you propose to have once when you get a satisfied number of results, once you have it? Then how do you propose to take it forward?
So one thing that we want to do is use the numbers that we are getting is influence policymakers. I mean, we have a strong focus on disseminating our results to policymakers and making them aware of what's happening in the country in terms of the psychological effects or the mental health effects of the pandemic. We are going to put out reports in the public domain at regular intervals. In fact, we are working on the first one at the moment. We are kind of trying to educate the public as well as policymakers on the impacts. We'll also try to educate the public on what they can do at their level to ensure that they can take good care of their psychological health or their mental health. We are looking at influencing policymakers in terms of giving them evidence or existing evidence that we have from the work that we have done on things that can be done remotely, things that can be done using non-specialist health workers, which does not require psychiatrists or psychologists or highly trained mental health professionals to increase access to frontline mental health care or psychological health care. We're already doing some of it, and it's happening in various pockets of the country, including our Sangath, where we are partnered with the Psychiatric Society of Goa and other like-minded NGOs in Goa, like Kuj, where we and the industry, where we introduce this COVID AV package, where people can access free mental health services using technology, and there's no rocket science there. It's just a platform which allows people video consultations country. It's what we want to understand now, what we want to try to do now is to see if we can scale this up. We want to scale this up and do the same thing that we would want to do with the survey, right? Right now, the access to a lot of these platforms is to the middle class, educated population of the country. But we want to see how we can scale this up so that people who are not from that particular socioeconomic group, from low socioeconomic strata, people who are actually more affected, access to this technology so that they can get mental health services sitting where they are.
Yeah.
Before we conclude, what would you like to appeal to our viewers from your side, how they can participate in the survey and how they can benefit, or we all can benefit from the participation? And please tell our viewers something.
Sure. So as with any kind of research data, the more data we have, the better picture we are able to paint. The more useful it is to policymakers to plan action. And so the more number of people completing the survey, it's better for us in terms of actually telling people and policymakers what are the real impacts of this pandemic on people's psychological and mental well-being. So my appeal to all of you watching this video is if you could go to our website called sangathsurveys.com and complete the survey. That's one. And two, if you have completed the survey, and once you have completed the survey, if you could disseminate information about this survey to the networks, networks that you have, as widely as possible, so that more and more number of people complete this survey and help us get a better picture of how the pandemic is affecting the mental well-being or the psychological well-being of people of India.
Thank you, sir. Thank you for your time, valuable time. We appreciate the efforts that you have taken. As you all heard, Dr. Nadkarni appealing to everybody to participate in the survey in large numbers, because it is for us, for our well-being and our future, the future of our children, that we need to give the experts the right kind of information so that the right kind of intervention strategies are formulated and are conveyed to the government so that our lives are improved for better. This is Shashwat Gupta Ray along with Arvesha Ghosh for Uncovering India. Thank you.